seconds, 20 seconds to tell us that.
Hello, my name is Yashika Williams. I am a partner with Heraclides Gilman, a regional firm, and I am out of Tampa, Florida. I'm excited to be here.
Rhonda.
Hi, I'm Rhonda Hammond. I oversee the work comp program for Ascension Health. We're located in 22 states, have about 160,000 associates, so very involved in the healthcare industry.
Dr. Hall.
Hello, everybody. My name is Robert Hall. I'm the medical director for Optum's Workers' Compensation and Auto No Fault. My background is physical medicine rehabilitation, so I'm excited to speak with you this afternoon.
Jeff.
Good morning, Jeff Adelson. It's firm Adelson McLean in California.
And Hiawatha.
Hello, my name is Hiawatha Franks. I'm in Austin, Texas. I work for TASB, Texas Association of School Boards. We provide workers' comp coverage for about 500 school districts throughout the state.
All right, panel. We're going to start with our first fact pattern. And we have an essential employee, whatever that means in your particular state. Let's say it's transportation, but who knows? It could actually be someone in the medical field, hint, hint, Rhonda. And this person works in, let's say, transportation, lives in California, likes the beautiful weather there in Southern California, but was hired out of Texas. Not sure if it's from a phone call or an email. Don't know if that makes a difference. Maybe there's a choice of venue provisions, but any which way, the employer is based in the great state of Texas and has insurance down here. And the person travels from California, travels to Texas, always spends at least 2 weeks in Texas every single year working here. This particular time came to Texas, it's a little unclear, maybe 7 days, maybe 14, maybe 21, we're not really sure, but then goes off to Florida. And while in Florida, has such a great time visiting the Tampa area beaches, a little south of Tampa. And you know what, down there happens to get this brand new disease in 2021. It's called SARS-CoV-3, and they called it COVID-21. So it's not the same COVID-19 that we have right now. And in fact, people and experts are saying it's really maybe not a SARS, maybe it's more of a vascular type of problem. So claims workers' compensation benefits during this time period. And you know what? The employer is trying to decide where to file this case. And should they file it there in California? Should they file it in Texas? How about there in Florida? And you know what? It's interesting because depending upon which state, the defense attorneys have given different opinions. In fact, in Texas, they said we can probably dispute that particular claim. But let's see what state should start this off with. And Nishika, is this something that's compensable in Florida? What advice would you be giving this transportation company of this essential employee who's helping out our country and has gotten sick on your watch?
On my watch. Okay. So first I would have to ask some more questions about the extent of the employee's work in Florida. How long was he in Florida? What was he doing in Florida? Was he just there to deliver items and return the same day? That all plays a part in figuring out what the jurisdiction is. So in order for the case to have jurisdiction in the state of Florida, we have to look at where was the contract? So the contract was in Texas. What were the conditions of employment? Obviously he seemed to be a traveling employee. Where was the principal location of him performing his job duties? Were they in Texas primarily and he was just doing a quick run to Florida? Or was he routinely traveling from Texas to Florida in order to perform his job duties? Then you want to find out how often is he in Florida. So all of those factors come into play when trying to assess whether Florida would have proper jurisdiction.
Is Florida going to consider this a specific type of injury, or is this an occupational disease? And would it matter if the injured worker said, my boss called, we decided to go have lunch together, and I got it from my boss. I know because I travel everywhere, so it's only at lunchtime and only at lunch with my boss. That's where I got it from. Does that change your analysis at all?
It could possibly. first I want to know, were you and the boss, was the employee and the boss at lunch for personal reasons? Were they discussing his job? So that will come into play regarding whether it's compensable. Second of all, because SARS-CoV-21 is, if it's anything like COVID-19, it's running pretty rampant all around. So he would have to be able to prove that he in fact was exposed specifically by this particular supervisor. And so we would say it could possibly be compensable, but the occupational disease standard in Florida is very high, and I would feel good about potentially denying that case.
All right, so Florida is going to come out and give some advice to the employer and the carrier to deny it. But let's take a step back. The employee decides, I live in California, I live in Southern California, and the 25 previous workers' compensation claims I have filed in California, they've always been compensable. Let me talk to a defense attorney down there. Jeff, what would you say to these facts? What are you looking at to determine if this should be filed in California and whether or not you think it's compensable based upon the little information you know so far?
Sure. Well, first of all, it's going to be up to the injured worker where it's going to be filed. Whether the court assumes jurisdiction in the other states is another question, but the employer is not going to decide where it's going to be filed. The injured worker is going to decide. Secondly, if this is a valid contract where the injured worker is a resident of California and the contract of employment was made in California, either by phone, email, written contract, then California is going to assume jurisdiction over the claim. So we have California. He flies to Texas. I don't know what he did in Texas or how long. If he went to lunch in Texas, is that what you're telling me, with his boss?
No, that was in Florida.
Oh, okay. So what did he do in Texas?
Hold on. Just to make it interesting, he had lunch with his boss in Texas, and he had lunch with his other boss in Florida, and they both had it.
Well, that's interesting, because if we were talking COVID-19, we kind of know where, at least in California, where our 14-day window is. We can do some tracing back. But I don't know about COVID-21. So it kind of depends what the medical is on that. Obviously, you want to know how contagious it is and how people contract it. And if it's close personal contact, as in COVID-19, then we'd want to see some information about the person he had lunch with in Texas, and then go back in time and see how long it took for symptoms to arise. And then he gets on the plane, he goes to Florida, has lunch with his boss in Florida. Both guys have it. Well, maybe he didn't catch it from both guys, either guy. Maybe he had it and gave it to them. I mean, we don't know. So you're gonna have to have the doctor involved here and give us some medical guidance on it. And after we have the medical guidance and we have the things as we have in California regarding 14 days, date of testing, et cetera, then we can give you a pretty good answer as to the defense.
That's mentioned that you have to talk to an expert. If we just had, we do, Dr. Hall. Let's go into this conversation a bit. Let's say that COVID-19 has a lot of similarities with COVID-21, except this vascular component. And we'll get into the presumptions and why that might be important in a minute. But tell us from a medical perspective. This employer is about ready to decide which state to initially file this claim in, but they want to know if this is something that's really should be considered work-related. What information can you give us about these types of communicable diseases versus whether or not it should be considered an occupational disease, at least from a medical perspective?
Yeah, thanks, Stuart. And I think Jeffrey hit the nail on the head there with the timing of the exposure. So taking a step back, we all have this experience now with COVID-19, knowing that it's transmitted from a respiratory standpoint through respiratory secretion. So let's say a cough or a sneeze or even conversation. And so the thing about COVID-19 that links it actually with COVID-21 that we're discussing is that both have actually had some involvement with the vascular system. So it's not really that far of a stretch to make it that COVID-19 and COVID-21 both have this vascular component. So what we saw in early spring of this year, so March and April, we saw that patients with COVID-19 were developing vascular complications. These were young people going into the hospital who had had a stroke, a vascular complication. These were young people who were in the hospital with deep venous thrombosis or DVT that may actually progress to a pulmonary embolism. Again, another vascular complication of COVID-19. So the point there being, it's not that far of a stretch that our COVID-21 does have a highly vascular component. And I think the other thing there too that Jeff highlighted on was that, who had this disease first? Was it the employee or was it the employer? And I think in that case, if both of those employers, if both of his bosses end up becoming more symptomatic with this disease, or if they start showing symptoms before he does, then we would say that it was most likely his bosses who were affected. Unless they happen to be asymptomatic carriers, that would make it more difficult to prove that. But the point there being, though, is that timing is very important because we do know that it takes, at least from what we've seen with COVID-19, that it does take several days, possibly even a little longer, to start developing symptoms.
All right. Well, I want to get back to you in a second, but now I'm gonna get Jeff and Yashika to give me some information here. I'm about ready to make a decision. Rhonda is about to make a decision here in a second, but she needs to know something. The reason why it's so difficult to prove this, like Dr. Hall was discussing, is the reason why we have presumptions. The only reason why you need a legal presumption is because you can't actually prove it with medical evidence. Does the presumption apply in your state? Jeff, first with you.
Well, let's say in our state, it would be a rebuttable presumption. And of course, the rebuttable presumption gives you a little bit of a chance as a defense attorney to do certain things. And in my case, yeah, it would impact it. I would want to learn a lot about this employee. You've already told us in fact pattern that he is an essential employee. We do have to determine he was on the job. We do, in our state, need a test, and a specific test. We want to know what type of test it was that found this person to be positive for the disease. And at that point, we move forward. I don't know what more I can tell you about it.
All right. Does your rebuttable presumption apply only to respiratory illnesses, or would it also encompass a vascular injury? Does it encompass both? And if so, what date do those presumptions go into effect?
Our presumption in regard to COVID-19 applies to COVID-19. So if it's COVID-21 and it's not derivative of COVID-19, then we have no presumption. It's a different disease. It's a different injury. And at that point, we would treat it as if we would treat any injury, and we wouldn't have a presumption to worry about. If it's COVID-19, yes, there is a presumption. This person is a private employee. He's not a public employee. So I don't have to worry about a presumption. If you tell me it's COVID-19, yes, then I do. And then under the governor's executive order and the assembly bill that we've had and the Senate bill that we've had, yes, at that point, different dates apply, and we would have to look at the date. But I have no presumption based on your scenario.
Jeff, we could probably assume, if based upon your state's reaction to COVID-19, that there might be similar provisions, whether by executive order or by the legislature acting, that there might be a presumption for this COVID-21 in the future if it's the same type of pandemic response. Fair to say?
Well, I'm going to tell our governor not to do that. Yeah,
I'm so glad you have this power, Jeff.
Hey, well, I say, listen. So it is safe to say that, yes. So if we do have a presumption, then I believe the best thing we can do is contact tracing and find out where. And of course, under our presumptions, we do have some degree of evidence available to us to rebut it, depending on the rules and the safety. The safety implementations put in effect by the employer. We can show that. Hopefully, the employer, Laude, did a great job. Everything's safe, and we can
Jeff,
go.
I'm going to cut you off here because you're in Southern California, right? It's compensable. It's compensable in Southern California, isn't it?
Well, no, it doesn't have to be, and that's why you're in Texas and I'm in California. I'm going to tell you we're going to find a way to at least raise defense.
Yashika, Florida, presumption apply?
There's no presumption in Florida for COVID. We do have some presumptions for heart and lung under for protected employees. So you have your police officers, your law enforcement officers, your fire personnel, your EMT personnel. Those people would have a potential presumption, but based on the scenario we have of a transportation worker who, although is essential, would not have a presumption. And the standard is very high for even vascular injuries or occupational disease injuries in Florida. It's a clear and convincing standard. So it's a very, very high standard. You have to show what substance you were exposed to, that the exposure actually occurred at work, and that there is not widespread exposure to this particular disease in the greater population. And as it relates to COVID-21, I suspect it would be very similar to COVID-19 being very widespread. You also have to have medical evidence by a doctor saying, an expert saying, listen, this person was exposed, this is how much they were exposed, and this amount of exposure resulted in this person suffering with SARS-CoV-21. And that's why the standard is just so high and so hard to meet, especially in this particular instance.
All right, Rhonda, we're going to bring you in now. You're an employer. You're the employer of this essential employee. And your general counsel's come to you and said, I've talked to our attorney. We got this great attorney in Southern California. He fights the good fight down there, but we know how California is. This is going to be compensable. He's already told us the presumption's going to apply. We got our great defense attorney down in Florida. We really like her answer. It's not going to be compensable in Florida. We have a good argument to fight it down there. And we've talked to our Texas folks, and Texas somewhere in between. They think it's a good defense, but we just don't know what's going to happen down there. It's somewhere in between those two states. We have the first right because we're going to file our first report of injury. The injured worker hasn't yet filed in a particular state. We have the first right to file in whatever state. Now, he can, of course, decide to do something different, but he may just go with the state that we choose. It's your money. Let's say you're either a certified self-insured or you're someone with $1 million deductible. You can file it with Yashika, or you can file it with Jeff, and it's going to, at least initially, which way the case is going to go. What are you going to do?
Well, and I think we would assess regardless of what jurisdiction, and I'm going to take it out of the transportation and I'm going to put it on my home turf with healthcare. And we've had executive orders, and early on in Michigan, March 18th, they came out with an executive order for presumptions in healthcare. But even with the presumptions, as the employer, we need to do our due diligence, and the definition of exposure has evolved if we're talking about COVID-19 from the onset to now. And if we make across our continuum of the 22 states we're in, we evaluate them based on the CDC's definition of exposure, regardless if there is an executive order for presumption. So I would like to say we would hold true to our mission, vision, and values at Ascension, and just really across the board do our due diligence for that contact tracing, I think, such as Jeff mentioned, and identify if we have a work exposure. As far as what state, we would likely defer to our legal counsel, regardless if this was a physical injury, or a contracted infectious disease.
Rhonda, I'm going to be your CEO, and you don't work for your current employer. You work for a different employer. You took a 50% pay raise, and you came to work for my company. And I'm the CEO, and I just heard your presentation. And my response back is this: Rhonda, I'm sorry, that was a bunch of BS. We are leveraging money. We are not making near as much because of the pandemic. We need to save as much money as possible. I don't want to violate the law, but I want to push it as much as we possibly can. I don't care what legal opinions you get or medical opinions you get. Rhonda, what state are we filing this in? Defend yourself.
California, absolutely. It's an infectious disease. You're at no greater risk than the general population. We can't prove if it was social. Unable to do contact tracing based on the evidence we have today. We were going to pursue filing in California and make a recommendation for denial.
All right. Well,
and I got a bonus this year.
Your walking papers will be at the end of this. Hiawatha, 30 minutes, and we're just now getting to you, sir. You're an insurance carrier, and you have this employer who's got a fairly high deductible. Let's say it's around 50,000. Okay, and you can decide, because you're going to be the carrier in this case. They're reporting it over to you, which state to file this in. And although it's a $50,000 deductible, we know that vast majority of COVID-19 and let's say COVID-21 cases are really small. They're not a lot of money. But the ones that are big, right? They're going to hit you pretty hard. You, as an insurance carrier, have a duty to your policyholders and your stakeholders, right? You have a duty to the people that own stock in your company. You got a legal opinion. California, it's going to be compensable. Florida, not compensable. Texas, don't know. What are you doing, sir?
So, and I'm the insurance carrier.
You're the insurance carrier. You have underwritten the policy here.
So, in general, if COVID 2021 is like COVID-19 in Texas, we will consider it an ordinary disease of life, even if he contracted it from his supervisor, unless the job or the employment put him at a greater risk than the general public. So it's probably not going to be compensable in Texas. It probably is going to be compensable in California. But I would really defer to the injured worker. So if the injured worker claimed in Texas, I would go with Texas. If they claimed in California, we would file it under California. So ethically, I think the right thing to do from an adjusting perspective is to follow the adjuster, the claimant's lead on what state they prefer. But if they had some contact in Texas, they traveled to Florida, California, you could have a situation where the person could legally pursue benefits under 3 different states because they meet the criteria for significant contacts in those states. So if the person was neutral and they just actually called the employer and said, I was injured, this is my situation, file a claim for me, that's really a dilemma for the employer, because the employer should determine what form they're going to complete, under what state. And if they reached out to the carrier should tell the employer kind of what the lay of the land is. That's a really tough call, because again, I would defer to the claimant. If they filed in Texas, I would go with Texas. If they filed in California, I would be neutral. I just handle the claim.
I understand you're neutral. Let me give you a couple other facts. You're right. All 3 states have jurisdiction. All 3 states, it meets the constitutional requirements of those particular states. But the injured worker is injured. I mean, he's in Florida. He's down in Tampa in a hospital, and his heart condition it's serious. He can't tell you what state to go with it. And the employer's throwing their hands up, right? Because they don't want to be involved in this. They have a relation. On one hand, they want to do what's right for their employee. On the other hand, they don't want to spend a lot of money, including that first 50,000. So it is going to be up to you. And your attorneys have told you which states are the best to file this in. What are you going to do?
I generally go with the state that the person resides in. I think that's the most practical approach, unless you live in DC and you got DC, Virginia, and a whole bunch of states like Texas, where you got to drive 8 hours to get outside the state. So, but if I would normally default to the state that they reside in, because if there's litigation, if there are issues, they're going to be litigated in that state, in their home state. They're going to need medical treatment in their home state. So I think that's the most practical approach to take.
let's say it's filed in California. We retain Jeff because he's the best guy down there to do this. Plaintiff attorney hires an expert. His name is Dr. Robert Hall. He's now a plaintiff expert. Dr. Hall, what testimony will you be giving to the California workers' compensation system in order to justify that this is a compensable exposure?
What I would do is I would point out the increased level of risk that the employee had during that time that he contracted this disease. And so if we do know, let's say he was an essential worker, or let's say he had some exposure to the healthcare system, for instance, if he was surrounded by people who had a high likelihood of having this disease, I would put that first and foremost in terms of the place that he most likely would have acquired this would be at his occupation level. Makes it more difficult if he has exposure potential outside of that. But that's what I would be looking for. I would be looking to see if he is in a place of work where he is surrounded by other people who have a high likelihood. Let's say he does healthcare work, as I mentioned, or if he does any type of transportation, or if he is in a high level of contact with the general environment as a result or as a requirement for his work. That's what I would be looking for.
Jeff, how would you cross-examine that testimony?
I would only be able to cross-examine the testimony based on what I was able to obtain from the injured worker in a deposition and on social media about what his whereabouts were, what he'd been doing. If we were able to find something on social media that he went to a rave the night before, I'd want to trace back 14 days if we're talking COVID-19. I'd want to know everything this person did. The fact of the matter is it's likely to be found compensable because of the presumption. But one thing I think we've omitted in our discussions today is where do we assert and where do we have the greatest amount of medical control? So I think you have to look at these presumptions and the quick provision of medical control as part of your risk management program more than anything. Now, we all like to say we can fight these things, and we've talked about how we can do it in different ways that are available to us, and they're not plentiful. But what we haven't discussed is how we address the medical issues promptly, quickly, so that we can control them as best we can, get the treatment to this individual as quickly as we can, avoid any complications that may arise as a result of the disease as quickly as we can, because that, if you're going to save money on these cases, it's my belief in California, that's where you're going to save it, and that's your best control.
So if I can just interject, so one of the things, like even backing up further than that, it sounds like this person is a long haul truck driver. That's from the profile. If you drive from Texas to California, you probably have the safest job as with respect to exposure to COVID. You're in a truck all day for 8-10. Most people can't. They're self-isolated in a truck, and so if talking about a rebuttable presumption, that person's occupation may be deemed to be less hazardous with respect to potential to catching COVID than any other occupation. If you're a long haul truck driver, unless you stop at Buc-ee's and really socialize, if you keep a mask on at the truck stop, you're good. So the person actually has a lot more control around their surroundings than their typical occupation.
Good point, but we might have a plaintiff might hire Dr. Hall and say, Dr. Hall, let's say this is even more of an aerosol disbursement than COVID-19. I might be able to work from home. This truck driver has to stop and get gas every, several hundred miles and has to eat at public places. And the aerosol, there's some new statistics that say that it lasts for hours in the air. You're the plaintiff attorney, or rather, you're the doctor hired by the plaintiff attorney. Are we going to make an argument? Can you going to make a medical argument that aerosol puts this truck driver, this essential worker, at a greater risk than every single one of us that are working inside of our homes right now?
Yeah, I would have to say that as long as he doesn't have any other demonstrable contact, like let's say no family members are sick and he doesn't really go outside of his home when he is at home, if that, at least looking at it from a medical standpoint, if that's the only potential, he's out in the environment getting exposed to this virus, that's where I would put it then, is that it did happen on the road while he was out. Otherwise, we would see infections within his home, within his household, or within his close social network is what I would expect.
Let's assume this was in Florida, and you already heard Jeff say how he would cross-examine Dr. Hall, the legendary plaintiff expert in this case. How would you cross-examine? And please don't do it now. Dr. Hall would cry after your cross-examination. What are the topics? What strategy would you use with that type of plaintiff expert testimony?
I would ask some questions that relate directly to the significance of the exposure and how it is so prevalent in the environment and how it could be found in any environment. I would ask him questions about how long does the claimant have to be in an area in order for the exposure, if it is aerosol, to actually expose the claimant. If we're talking about someone who's a long distance truck driver, he's not stopping off at Sunny's to have dinner. He's eating in his car. He's eating in his truck. He's probably, when he goes to the gas station, running in to the gas station to pick up chips or a sandwich, and he's running back to his truck to drive. I mean, he only has 10 hours to make that drop, right? And so his time where he's actually exposed to people, even if it's on the road, is still very limited, as Hiawatha indicated. And so I would want to know what level of exposure is he going to have just in the general public, going to and from his car, going to some of the public places that he may go to on his own, even if he is pretty much quarantined in his home for the most part. And so I would challenge ways in which he could contract the virus just by being out in the public. And so that would be a big deal for me, because he would have to show that he actually contracted it at work. And if we can show that he was able to contract it in any other place, at any other activity that he participated in, or any other store, restaurant, office that he'd stopped off in his personal time, then that would give the defense a strong argument as to compensability. And if I can really quickly, Stuart, just add that for this particular scenario, there is not a presumption, but Florida does have an executive order that pertains to first responders, healthcare workers, who are on the front lines of defending and protecting our community from COVID-19. Those people do have a presumption, in a sense, regarding their exposure if they are able to allege that they were exposed at work while providing care and treatment to maybe other individuals who actually have the virus.
What if this injured worker was carrying an 18-wheeler full of N95 masks to a hospital for Ascension in Florida in order to protect nurses and doctors?
Well, in that particular instance, I would argue that his delivery of those products does not necessarily put him in direct contact with the people who are providing the care and treatment to those infected persons, that he's probably delivering either to a warehouse or to someone who doesn't come in direct contact with patients who actually already have COVID-19. So that would be more so, along with what Hiawatha is saying, his level of exposure to someone who's already exposed would be very low.
So
right, let's go ahead, Hiawatha.
So just to, when you look at the CDC guidelines around close contact within 6 feet for 15 minutes or so, with or without a mask. So you almost got to put that layer on top. When he dropped off, were you within 6 feet of anyone for more than 15 minutes? He may just back up, drop it. You could have protocols so tight that you make sure they're not in close contact within 15 minutes. And if the company has that type of protocol, that even really reinforces your defense.
Well, I got to be fair to our other expert here. Let's say, Yashika, that you've got Rhonda and Hiawatha want you to hire the best expert in the nation. Happens to be in Florida. And it's funny because he's also Dr. Hall, just a different middle name. Confusing. But he's the preeminent defense expert in this particular state, and you've had this woodshedding session with him, and now let's talk with him a little bit. Now, defense expert Dr. Hall, is this compensable? Should this be compensable as COVID-21?
I would say that based on what we've seen with COVID-19 and the experience that we've had thus far, that there is such a widespread outbreak and there is such a high degree of asymptomatic spread out there in the general community that unless there was some specific contact tracing or there was some specific instance where he was obviously in a situation that made it more likely that he was going to contract this virus from somebody at work. If he was in a very closed, let's say a very small room for somebody who has the known virus and they are coughing and they're not wearing masks, if they're in a situation where it's an obvious display of not following the guidance and social distancing and mask wearing, all those things, I would say with the widespread nature of the virus, that it's more than likely that he contracted it somewhere else in his own community and his own surroundings, and likely not at work, just based on how widespread and contagious this is, and put that in comparison to what he's doing to protect himself with his job, where he's not becoming that close to, he's not getting in that close of contact with the general population.
If I can answer it,
Florida?
well, I'm glad you asked, because one of the things that's very important and a good feather to have in the cap of a defense attorney in this particular instance is, was this person following the CDC guidelines? Was he or she wearing a mask? If he or she wasn't wearing a mask at the time of this alleged exposure, then in Florida, we can take a 25% reduction, a safety reduction on future indemnity benefits based on the claimant's failure to follow safety protocols. And in this particular instance, if we have a person who says, well, I was around truck driver A for 17 minutes and he wasn't wearing a mask, then my argument is, well, if you had been wearing a mask, limited your exposure, were less than 6 feet away, we would be in a different scenario. You may not have been able to contract the virus. And so I would talk to Dr. Hall about instances of the claimant not following the safety protocols, and how that could impact or increase the likelihood of him contracting the disease. And use that to, if we were required to pick it up, we could reduce our exposure under the safety device, failure to wear the safety device.
Jeff, your instincts were correct. The injured worker, his family decided to go ahead, and even though it was originally filed in Florida, they moved it to California. It's in front of your state, and Dr. Hall is licensed to testify, or licensed to practice medicine rather, in California, gave you the testimony that he just gave you. What's the ending result there in California?
Again, it depends on the facts. If the person's an essential worker and the exposure took place in the course and scope, and it's quite obviously it did, the person's exposure is greater than that of the ordinary worker, I think the doctor's opinion is going to support a compensable finding. And I think that's simply it.
Okay. Let's move along a little bit here. Let's say while he's in the hospital there in Tampa, they do blood tests, as of course they're supposed to do, and the blood test comes up positive for the metabolite of marijuana. Now, mindful that we had a recent election. I don't know if any of y'all are aware of that, but in that election across this state, we've had an extension of 5 other states with recreational marijuana. But this guy is positive for marijuana. And let's say the level is fairly high, whatever high is for you. Does this impact compensability? Florida, you're first.
Okay, so in this particular scenario, it's pretty difficult to say, because you have a person who at this point is in the hospital. So how long have they been sick? When they first contracted or were exposed to the virus, were they intoxicated at the time? And when I say intoxicated, I mean, do they have this drug in their system at the time of the exposure? And for us in Florida, that's a big deal. When did the exposure take place, and when was the test done? So if you have someone who has the virus, is now hospitalized, I would say maybe he's 7 days away from the exposure. I talked to Dr. Hall about it. Strategically, you could deny it. But how strong is the denial if you have a person who potentially was exposed to a virus that they would have been exposed to regardless of whether or not they were high or not? And so then I guess the argument could be, well, if you weren't wearing your protective gear, were you not wearing it because you were not necessarily completely lucid, or you were more lax with the safety protocols because you were intoxicated, that's an argument that I would raise. Of course, the claimant would have the ability to say, listen, I would have contracted COVID-21 if I was high or not, because my intoxication has nothing to do with my exposure either to another person or aerosols containing the virus. So from a strategic standpoint, depending on how much you want to fight, it's something you could raise, but I don't think it'd be very successful.
Jeff, how about California?
California, it really wouldn't matter. We have to define whether this exposure is a result of a specific incident or something that occurred over time. It obviously probably occurred as a result of some specific exposure somewhere. Whether or not this individual was smoking marijuana probably had nothing to do with that exposure, unless you can go back and do contact tracing and find out he was at a party and they were all sharing the joy of getting high together and smoking together and sharing that. But even at that, you would not deny it because of intoxication necessarily, especially at the point in time when he goes to the hospital. He's already had symptoms, and we have to believe he's probably had symptoms for more than one day. So the proximate cause between the illness and the use of the marijuana just doesn't seem to me to be able to be established under your scenario. And California, unlike California, does not have a presumption. It has to be, you have to prove it.
So employer, carriers, Rhonda, Hiawatha, you get this terrible news, one of your employees is injured, but you also realize tested positive for marijuana, and that's against federal guidelines, especially for the transportation DOT rules. Now you got a worker that's perhaps been smoking while driving. You're not happy about that. What are you going to do with this information? Rhonda? I think you're on mute.
Sorry about that. I mean, I think we would have to look at our internal guidelines, the DOT, and I'm not that familiar with the transportation, but I think about our drug policy that we have within Ascension, and it would be to look at the time that was obtained, that they were tested, when they last worked, and kind of compare that, because I think from a compensability standpoint, I would go back to the defense counsels and what they have raised. I think I would focus more on the employment side at this point. As the employer, I would get, with regards to compensability, I would rely on my carrier and our defense counsel. But I think I would then have to go back to HR and develop a timeline of when they last worked and the time of the positive test. I would be focused probably more on that.
Hiawatha, give us your thoughts about this development.
I totally agree with Rhonda. This is more of a human resources issue, a DOT compliance issue. From a work comp perspective, intoxication is a defense in Texas, but it's so hard to determine even the date of accident or the date of injury or the date that someone contracts a COVID-19 or COVID 2021. And then, so I don't think intoxication will be an issue from a workers' comp perspective.
Indeed, in different states, and you've heard folks talk about this today, in different states, intoxication has to be the proximate cause of the accident. In other states like Texas, it doesn't. You just have to be not have the normal use of your mental or physical faculties. And in Texas, you can't apply the intoxication defense to an occupational disease. You can only apply it to a specific type of injury. I'm wondering, Dr. Hall, last question on this. Would any of your brothers and sisters be willing to testify that smoking marijuana made it more likely that they were going to contract COVID-21 or even COVID-19?
Yeah, and I think everybody's pointed out the importance of timing here. One thing I'll say about the THC in the blood is that the THC blood level rapidly declines in the blood after that person's done, let's say, using marijuana or smoking marijuana is a good example. So it rapidly declines within an hour or so. And so what I would be looking at if I were to say that this had something to do with his injury, with his contracting COVID-21, I would say that if his level was that high, if it was really high when he was being evaluated, there's a high likelihood that it's been running even higher when he's actually using marijuana, putting him in a higher risk for not following social distancing, not using a mask, and that sort of thing. There's not been any real proof out there yet that using marijuana puts you at a much higher risk for developing a disease or contracting a virus, for instance. But here's the one but. The American Lung Association says that the chronic use of marijuana can damage lung tissues, and that has the potential to impair the lung's immune response, to potentially an infection. Now, there's not a lot of evidence out there to show that this is happening ongoing, or that this has happened with COVID-19 as of today. But those might be two places, though, that my colleagues might look at. Is he a chronic user of marijuana, potentially making himself more at risk for not following social distancing, not following guidelines? And then has he had any permanent or chronic lung changes or lung damage as a result of marijuana that could potentially have put him at a higher risk for contracting the virus, potentially?
Hi, Walter. I want to give you now a chance to kind of give a big picture approach. Step out of this particular fact pattern. We're living in interesting times, and let's limit that to workers' compensation. We're living in interesting times with COVID-19, and I tried to push that a little bit with COVID-21. Just from a big picture perspective, tell us your thoughts about how you think all this is going to end up impacting what we now call the workers' compensation system.
I think we're going to see a lot less injuries. We're going to see a lot larger work from home population. I'm really concerned about what it's going to do to our education system. There's going to be a gap, achievement gap, the difference between. It's going to create. I think the comp industry is going to be smaller because we're going to have less people actually working on site. For example, even in school districts with remote learning, our claims are down about 30-40% because with the virtual learning, we don't have as many buses on the road. We don't have as many teachers slipping and falling, having back injuries. They're working remotely, and I think a lot of workforce is going to shift to home-based work. So I think the incident rate is going to go down. I'm not sure the legislature's coming in town soon, and I'm not sure if they're going to pass a presumption rule for first responders, healthcare workers around COVID-19. I mean, it's around any pandemic. So I think state by state, we may see a lot of variation between how different states handle pandemics going forward.
Last question, and we know we need to get you out of here. Is the flu now going to be considered a workers' compensation injury if COVID-19 is considered a workers' compensation injury?
I hope and pray not. No.
Well, that didn't answer the question.
No.
It's going to be.
It can't. Please no.
I think we do have to draw the line. The issue is when there are stay-at-home orders, which has never taken place, and they say stay home. If your job requires you to leave the house, does that put you at a greater risk because you cannot stay at home? I think that's the big question to be solved.
Before I get to everybody else, and Ronnie, you were pretty adamant about this. I do want to go back over to Dr. Hall here. What's the difference, if any, between the flu, getting the flu at work? I work next to me and Jeff work right next door together. We share offices. Yeah, we see him. He got the flu. I know I got it from him. Or I got COVID-19 because he works next door. What's the difference?
I got to log out.
Yeah,
see you later. Appreciate it.
Yeah, so the question is spot on, Stuart. I mean, both are spread by respiratory transmission. Both result in very similar types of illnesses in terms of affecting the lungs, and both can be deadly. So your question's exactly spot on. I think the only thing I can say in this particular situation in terms of what the difference might be would be is that the flu does follow that seasonal widespread transmission, and there are vaccinations out there that are fairly effective against the flu as well. And so those would be the big differences, I would say, in terms of what we've seen so far with the COVID, having been this one season so far with it, as well as or this 1 year with it so far, as well as the current availability of a fairly effective flu vaccine.
All right, Jeff, closing arguments from you. Give me your big thoughts, and then finish off with, is the flu going to be compensable? Is the cold going to be compensable under workers' compensation?
Well, let me start with the flu really quickly. California has
we only have a couple of seconds here to close up, so.
All right. Shall I continue?
Yeah, just a couple of seconds. Just go ahead and give us your closing argument.
You want to know about the flu? Or you want my closing argument?
15 seconds.
Fine. Use all the presumption in your state as a means of managing your risk. Follow the presumptions, do the right thing by your employees, recognize that workers' comp is a no-fault system, understand the reporting requirements, and follow the rules. And if you follow the rules carefully and don't ignore it, I think you'll be able to contain your risk pretty well.
Yashika, closing arguments.
I would say I would mimic what Jeff has said. Be smart, listen to the science, follow the rules. And I've been known to be a rule breaker, but these aren't the rules to break. Follow the rules, keep yourself safe, and keep the people around you safe. And once we do that consistently, we'll be in a better place.
Is the flu and the cold going to be compensable at workers' compensation?
No.
Rhonda, last couple of comments from you. I saved it for you. You're the employer in this group. Any thoughts you want to have? And then end it with, is if COVID-19 is compensable, is the flu and the cold compensable?
I actually agree with the comments made by the panelists. We need to be smart. There are measures put in place. Yes, there are presumptive orders, executive orders, presumptions. And I think from a healthcare perspective, if you're truly utilizing the PPEs that are required in healthcare settings, then you should be more likely, at least the behavior we have seen, that you would contract it socially. It would not be a work exposure. And flu covered under workers' comp, no.
All I can say to my panel is you guys are amazing. It has been a humbling experience to prepare with you and to present this with you. I really appreciate the folks from, the Comp Laude is a wonderful thing. Work Comp Central does a wonderful thing, continuing with this tradition, and that's about ethically supporting everyone. The system is designed to support injured workers, is designed to support employees. I thank from the bottom of my heart each one of you, and we give this over back to Kristen. Kristen, thank you very much for, I think for all of us, thank you for allowing us to be a part of your presentation today.
Yeah, of course. And thank you. I know there's a lot of good insight here that is shared between all, we traveled the whole nation. So that was a lot of fun, and, getting the different perspectives and, seeing it all around. So thank you so much for agreeing to do it and being a part of Comp Laude. We do have a couple questions. So do you want me just to jump into them, Stuart?
Please.
All right. So
Rhonda's going to have all the hard questions.
Okay. All right. Can you use the contact tracing that the Department of Health does to help determine if it is industrial, or are you not allowed access to that information?
We're going to start with Dr. Hall.
I would have to double check. I know that there would potentially be some HIPAA requirements with that, I would imagine. So that would be the first thing I would think about, would be the HIPAA security part of that.
California. Jeff?
Well, California is interesting because we do have reporting requirements. Employers do have to report cases in the workplace. They don't have to give the name, but they are now being required to provide notice of cases within the workplace to their work comp carriers, not to set up a claim, but to report them per the law. And so there is that ability to do the contact tracing. You do have to be careful about names and such. But of course, if it's a litigated claim, then you're going to be able to, in California, sit down and take a deposition and try and get some answers.
Florida?
I would say you have to definitely report to the health department. And I don't, from my standpoint, that's something that would be handled primarily through HR. They would be pretty much investigating who the exposure was with at the office. So I would leave it up to them. But as Jeff has indicated, if the case becomes litigated and we're either determining whether we need to accept it or deny the case, then you were able to get a lot more information about who the contact was with. And almost you have to do your own contract tracing in order to assess compensability.
Kristen, I'll add this. There's also the real world issues. I'll give you an anecdotal story. One of my best friends from high school, who's on one side of the political spectrum, texted us all because he was so proud of his daughter who got COVID while her third year in college. And he was so proud when they called to do contact tracing, when she told them, go jump in the lake. It's a matter of privacy and you don't get to know who I was around. So you have the best plans, but sometimes our own political beliefs in this trying age kind of trump maybe common sense.
All right. So we're going on to the marijuana topic, gets everybody's attention. And this one says, this was asked, what if the person who supplied the marijuana was the boss supervisor the driver had lunch with?
Let's put this in a somewhat a better case. Let's say it's a specific injury, okay? Because I know most states usually have an exclusion as to an occupational disease. So it's a specific injury type of case, and the boss is the one that gave him the marijuana, and it's not legal in that particular state. Florida, how do you respond?
Well, we can't raise. That's hard. I would probably still try to deny it. The problem, though, is the employer supervisor provided the drugs to the injured worker, so you can't raise intoxication in that sense because the employers provided the drugs to the claimant, and so that'd be hard. I think you'd have to pick it up.
All right, hold on. How about if the supervisor gave it at a party that night, not during work hours?
Then that's different. Then I would argue that you do have intoxication. But let me say this, in Florida, you really have to, if you don't have a drug-free workplace, you really have to make sure you get that sample. So you need to get with a good company that's going to go to the hospital or make sure that you are getting a sample that is the chain of custody is good, or else it hurts you as it relates to raising the defense. And then the question becomes, what was the injury? What was the accident? Was it one that they may have suffered regardless of whether they were intoxicated, or are we arguing that the intoxication is the cause of the injury?
Does your regulators make a distinction either in law or just by practice if the drug wasn't marijuana, which the tipping point is where over 50% of Americans believe it should be recreationally legally? What if it was crystal meth?
Oh, I think it's the same. I mean, definitely, because it's not a prescription. So whenever you are, you guys know this, when you go in to get tested for a urine test or a drug test for drugs, they're asking you what prescription medications are you on. So if that comes back in your test, they're able to check those off, right? So there's no prescription for crystal meth.
Well, there might be a doctor who might give one, but that's a different topic.
That's a different topic.
What's your response to this question?
Okay, my response is, one, if the supervisor provided the marijuana and the employer condoned it, you're not going to get much of a good defense. Second is, I want to know proximate cause. Did the use of marijuana cause it? Can you get the testing done quickly? Can you get the medical records? Can you show that there is a nexus between the two? If you can't, then you're not going to get it. I don't think it doesn't matter what drugs. If it was given to the person at a party that was off work, then the likelihood it's not compensable. But if it was a work party, and if the supervisor told the employee to be there, and if there was great pressure on them to be there and it impacted their career, then a good attorney on the other side might claim that it is compensable.
Kristen, I have found that intoxication is really determined by the state, both the written law and how it's actually practiced within that state. Very determinative of the jurisdiction.
Okay, so the next question, let's take out the party scenario. And if the patient used an edible marijuana to help deal with symptoms of generalized pain, how would?
Is the generalized pain part of the injury?
Let's say yes.
I agree. Let's say it is, and they took an edible, and two different trees on that. They took an edible, and the edible was prescribed, and the edible was not prescribed. Jeff?
It doesn't matter. My answer doesn't change. I don't care if it was eaten or smoked or, sat with a hookah, watching a movie. Nothing changes in my mind.
So there's no difference under your state's laws about prescribing this for general pain.
There is no such thing as a prescription for marijuana. There's a recommendation. And,
Let's say it's a recommendation under your state's laws, and they have that recommendation.
No, I'm not going to recognize it. I mean, I'm not going to accept it. The employer's certainly not going to give. I'm not going to consider that medical treatment given by the employer. If it was, well, and if some applicant's attorney out here would certainly make that argument, then yeah, it's going to be compensable.
Florida.
No, it's not compensable.
And by the way, all of you, I mentioned it, what percent, if the election goes to Vice President Biden, do you think marijuana is taken off as a Schedule I drug?
Yes.
Jeff?
I agree.
Joe hasn't called to ask me yet, so I can't answer.
Jeff never struck me as politically correct, but there we go. Rhonda, what do you think about that? Do you think marijuana is taken off Schedule I?
Did you say Rhonda? Sorry.
Yes.
Yes, I think it would be.
Doctor?
Take off.
Yeah, I believe at some point that will happen. If for no other reason, there's so much of the discussion out there in the medical community is about the research that is still felt to be needed with marijuana, and in many cases, the Schedule I is considered to be a barrier to that research. So I think at some point it will be delisted.
Depending on the audience, it is an interesting discussion when you have a comparison of opioids and marijuana and how that's interpreted and how people feel about that. But
That's a complicated discussion because you got to first tell people it's a false equivalency, and then you got to still standpoint of where there's a benefit and a harm to each of those substances, either recreationally or medicinally. Oh, I'm sorry, doctor, that was your take on it.
You did great. You did great.
Kristen, Yvonne?
Well, we could continue on questions. I feel like this sometimes needs to be a longer session. So maybe we'll do it again early part next year because I have a lot of questions, but there were a lot of kudos to the panelists, a lot of good points raised by all sides. So round of applause if we were in, you got the audience would be clapping right now. You all did fantastic. And I'm sorry, audience, if we can't get to the questions, but we will, this is the contact information for the panel. So if you do have questions or do want to kind of get some more feedback, they are there. It's also in the handouts, their contact information. But thank you so much, panel. Thank you much, Stuart, for moderating. It's been lively, and I hope we can do it again.
Thank
I was
you.
going to say, we were a little concerned about how this is going to translate to the virtual platform. I think you guys all did great. The only thing I missed was the in-person props and all the hand gestures that were.
Yes, we've had some costumes go up to pass, so yes, but yeah.
Great job, guys.
Thank you, panel.
Thank you.
Have a great.
Thank you.
Thank you so much. Goodbye.
Thank you.